Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Hi everyone, I'm Dr. Surbhi Chaturvedi. I'm a consultant neurologist. I work in clinic Sri Durga Neuro and Ortho Clinic, which is specifically for neuro and ortho. I am a visiting consultant in Trilife Hospital, which is in Kamanali, and Kaveri Hospital in Marthali.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
See, basically, the seizure is the electrical dysfunction of the brain. So, brain uses very tiny electrical signals to control everything, whatever we do. So, whenever any such kind of electrical dysfunction happens in the brain, it causes a seizure. That can present in any form, let's say, like loss of consciousness, shaking, or they become just confused, staring at one place, or even feeling of fear or panic. Some have feeling of aura is like a feeling that they get before a seizure. They would know that they are going to get a seizure. That could be in the form of abdominal discomfort and some blurring of vision, some nausea, vomiting. It could be in any form.
What is epilepsy?
See, epilepsy is a medical condition which includes recurrent seizures. So, seizure is a one episode. Whenever multiple seizures are there, it is called epilepsy. So, to call it as epilepsy, there should be at least two seizures. A person should be having minimum two seizures to call it as epilepsy. So, generally, if they have had two unprovoked seizures, meaning that seizures weren't caused by anything specific like high grade fever or severe infection or any other causes, but and there are different type of seizures also. While some people will have one type of seizure, another will have another type of seizure, some people will have multiple type of seizures together. So some episodes will be one type and some episodes will be another type.
What are the different types of seizures and do they affect people differently?
There are various type of seizures. So generally, what is the assumption is seizure? People, what people they believe is involuntary movement of body is a seizure, but that is not the fact. There are various type of seizures. So one type of seizure is generalized tonic-clonic seizures, which we very commonly see, and in that a person has involuntary movement of all parts of the body and loss of consciousness. There may be urinary incontinence, uprolling of eyeballs, frothing from mouth, complete loss of consciousness. When they regain consciousness, they may remain confused for a period of time. That can be followed by headache, generalized body pains, severe weakness. So this is one type of a seizure. Then there is another type of a seizure which is called as a focal seizure that involves only one part of the body, like one hand, one leg, or just face. Sometimes focal seizures can become generalized. So, by saying that, I mean it's starts from one part of the body. Say it starts from one hand, but then after few minutes, if not treated, it becomes generalized. So then the entire body would start having involuntary movements, eventually making them unconscious, and then the same sequence of events what we had discussed in generalized tonic-clonic seizures. Category definition of seizures have always been various types have always been changing. So now they are defining such type of seizures as simple partial seizures, which are like focal seizures, and there are complex partial seizures in which they would not lose consciousness. There wouldn't be any involuntary movements of the body. Okay, but they would be unaware of what is happening around them. They would be just doing something like screaming, just talking irrelevantly. But after few minutes, when they are completely normal, and you ask, "What were you doing?" they would not remember the episode. Then one more type of seizure is absence seizures, which we very commonly see in children also, where people would be just staring at a place for a few seconds. You keep on calling them and they would not respond. That may last for a few seconds to a few minutes. So this is broadly what we see majority times. Then there would be myoclonic jerks, which are just the jerky movements. So these are different type of seizures what we see.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
See, no, there is not always a known cause, and this is a very big challenge we face in our practice because when they come with a seizure, they always would want to know what is the cause, but not every time. In fact, lot of times it's not like some few times we are unable to diagnose what is the cause of seizure. Lot of times it is around 20-30% of the times we are unable to tell what is the cause of seizure. But usual causes of seizures would be, see, one is anatomical means like something is wrong with the anatomy of the brain. Suppose they had trauma in the past, injury to the brain in the past, or they had some kind of like genetic lesions in the brain, like mesencephaly and all those things. Okay, then other causes could be like tumors, and then strokes. If they had strokes, then that part of the brain is very sensitive to have electrical dysfunction and throw a seizure. As they age, the risk of seizures increases. Then any kind of brain infections, not even acute brain infections.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Okay. So majority of the things I think related to this question I have answered in what are the different type of seizures we see. So the things that we have to look for is jerky movements, losing consciousness, uprolling of eyeballs, frothing from the mouth, tongue bite, any strange or any abnormal feeling, or even moving of one part of the body, not the whole, not just the whole body, but even involuntary movement of one part of the body can be a seizure. So these are the major symptoms, like a staring look, not responding even when you're trying to talk to someone. Someone is just staring at one place, not talking to you, not responding to what you are saying, confused, irrelevant talking. These are the signs and symptoms we have to mainly look for.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah, so see, basically, previously people had never understood that historically they've never understood that epilepsy is a neurological condition. It is a disease. It is not like a frightening thing or a stigma to be avoided for. So previously, people used to think that someone had done some kind of magic or possessed. They have possessed. Someone has possessed this person, and that is causing epilepsy. And even people used to believe that epilepsy is can be transmitted, like it's a communicable disease. So that is why people used to have a stigma, and that is why they are all often misunderstood. They feel that if they stay with someone who is having epilepsy, they may also get epilepsy. uh, so yeah, that is the reason.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
So triggers vary from person to person, but most common trigger is missing sleep that we have seen in our practice. Other common triggers are high stress levels, skipping meals or certain food, fever, flashing lights, loud sounds, missing dose of seizure medications, hormonal changes during their menstrual cycle. Maintaining a seizure diary actually is very important to track every seizure and to write down trigger besides it, that what could be the possible trigger in this episode.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah, so see, many patients, when they come to us, they ask, Doctor, what should we do when, what medicine mainly we can give when they have a seizure at home, or what should we do? Or they, like when we had even discussed about stigma, one of the even stigma is that putting keys in the hands would stop the seizures, like that. So they believe that all these things can be done, or there are certain things that can be done that can terminate the episode. That is not true. Episode will be terminated by itself at home whenever the most important thing is they shouldn't have injury during that episode. So you have to make sure that surroundings are safe. Okay, most importantly, and do not put anything inside the mouth. Do not believe that giving keys or anything, or when they are having these kind of involuntary movements, holding their hands tightly to stop those involuntary movements would stop the seizures. That would not happen. And then coming, this is about, so whenever a seizure happens, let it terminate and come immediately to the hospital. Sometimes it may happen that it is not terminating in 1 or 2 minutes. You have to bring them in a similar way in the ambulance to the hospital. It is the only hospital that where we can give some kind of injections and all to treat it. In kids, we have started giving some sprays to terminate the episode, but usually we don't advise it like that. Now, coming to this is what you can do when you have a seizure at home. But what you can do to prevent a seizure is lifestyle changes like good physical activity, good sleep, stress management. If stress is there, then talking to a counselor, healthy food. There are certain diets called as ketogenic diets that also helps in treating refractory seizures.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Seizure is a very common thing. There is nothing to be worried for if you have a seizure. By saying that, I mean that, of course, there is a problem, but that problem is not something which is not treatable. Seizure is absolutely treatable. A seizure person can lead a normal life. They can do everything what a person who does not have a seizure can do, like marriage, having kids, studies, traveling, everything. They can enjoy their life, they can do whatever they want to do. Most importantly, They have to avoid alcohol, smoking, any other drug intake, and maintain a good lifestyle. And if they have a seizure, then they have to take medicines on time. Skipping medicine dose may trigger a seizure and may lead them to a life threatening situation. Seizure per se would not cause death just like that. Seizure per se would not cause much troubles because it is a self terminating event. But what happens during a seizure, like suppose you miss a dose and you're driving and you meet with an accident when you have a seizure, then what will happen during the accident can be a big problem. So you have to be careful with medicines, and you have to be careful with your lifestyle. Rest, you can lead a normal life.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.